I'm Lynn Holland. I actually am the director of Biomed at HonorHealth. It's a 9-hospital, about 350 clinics system. And I'm speaking on this topic because it's kind of a labor of love for me. We've had 3 acquisitions in the last 12 months, and they've been, am I doing feedback? Better? Okay. Labor of love for me, I have 70 technicians. They don't actually understand, or I shouldn't say understand, aren't as thrilled about inventory management as, let's say, leadership is, in that, that's how you procure your staffing, that's how you justify your existence to some leaders, right? So basically, we started doing rounding. We had to start with an inventory first, and so I'm going to walk through kind of how we did that. By definition, I'm the director of Biomed. I started out as a flight nurse in the military, came through IT to supply chain, and then over to Biomed. So I have kind of a well-rounded skill set that I'm bringing. So I look at this from a data perspective. Not everybody does. So with that, I'm going to start. So the background and the reason why I picked this topic is in 2024, there were 65 hospital mergers. What does that mean? That means somebody's acquiring somebody else's inventory and you need to know what to do with it and when. So the third quarter of 2024, 58 deals were inked. And so that obviously shows the pace at which acquisitions are happening. 2025 already 31 deals so far. And then over here in the corner where I have HonorHealth 12 months, there is a 33% increase in our acute care locations and a 35% increase in our non-acute ambulatory. Freestanding EDs, I know that everybody's aware of those. Those are the next big topic, and they're like micro hospitals. So you really have to keep that equipment up 24/7 or they go on diversion. So that was really what I was trying to factor into this. And then also this is meant to be interactive. So if you have any questions as we're going through, just raise your hand. So why? Why is the data important? FDA, 2 million reports annually related to medical devices. We know why the industry was started to begin with. It was for the patient safety. And then obviously it's the most highly regulated industry next to like nuclear, but the medical errors are the 3rd leading cause of death. So obviously our job, frontline workers, is to make sure that we're keeping the equipment safe, because the patients need us, and those patients could be your family members or your friends and so forth. So understanding the problem and the purpose. So the challenges with the inconsistent data causes downtime, causes nurses to scramble, causes us to go on diversion. There's many reasons, but really just knowing what you have out there and having it accurately documented that you're able to use it. So the purpose of the accurate data collection is not only for regulatory bodies, but it's also to keep throughput going on in our hospital and in our clinics. For example, one of our clinics, an ultrasound goes down, they go on diversion, a patient has to drive another, I don't know, 30 miles to get to the next site that might have that ultrasound. So it's very important to keep the equipment up and going. And the benefit for the HTM professionals, improved data practices. It helps them with locating the equipment, and then just boosting their morale, that they don't have to go scramble during PM time to go and find that device to check off that work order, so to speak, for that month. So the challenges and the impact of the data inaccuracy. We struggle with missing equipment, right? We don't have an RTLS system, and we're trying to institute that, but until then, we need to know to the best of our ability where that equipment is. The operational impacts, we have one hospital that routinely operates at 100% census. They don't have any room for errors to try and locate equipment. And then obviously the importance of the data integrity is just to be able to get staff, right? If you have 100,000 pieces of equipment as opposed to 80,000, that's several FTEs to be able to support your network. So any questions on that so far? Okay. So rounding practices. What we need to do first is start with an initial accurate inventory. So that's going to be done in chunks, and maybe you might start with doing a certain department once a month, once every couple of months. You're just going to be able to fit into what your schedule can accommodate. But obviously, once you do that, it's very important to stay consistent and continue the routine rounding so that you're not losing ground on what you're already establishing. Best practice, consistency, keep doing that no matter how you dice it up, and then making sure that it's becomes part of the culture of your biomed shop. So what I said in the very beginning, your technicians aren't always needing or wanting to understand the importance of the integrity of the data, but once it is accurate, they're very appreciative of that. And then establishing automated reporting. So what we did is once we knew the data was accurate, we would then schedule in our CMMS reports that would go out to our department leaders that would say, okay, this month we're gonna be in your department PMing, this number of pieces of equipment, and then, oh, by the way, next month, 30 days from now, this is what's scheduled to generate. So the CMMS systems have the ability to do that. So if you're not doing that, I would recommend that as kind of your first step to start to see where you lie with your leadership and kind of your load balancing. Yes.
Okay. It sounds like there's a little bit of a disconnect with the technicians understanding the importance of ground.
Yes.
How do you do that cultural integration at HonorHealth? How do you get them to buy into that?
So for my particular instance, I did a pilot. So basically, there's a couple pilots that we have going on. One is we put a bed board in the biomed shop so that they can know when patients are coming and leaving so that they can go capture that equipment. And then the second part is a different facility did rounding, has been doing rounding. And then at our all staff meetings, we bring that up. It's kind of like a little bit of a competition thing, but also explaining like the efficiencies of if you put the time in up front, then you'll kind of benefit from that when you're trying to close your PMs at the end of the month, so to speak.
Isn't there getting a little bit of exposure in those meetings as to why that data is?
Yes, exactly. Without having to, force feed them, as of the first of the month, you're going to do this, right? It's important to get the buy-in, right? Yeah. You had a question? A network all staff, yeah. So that the facilities can kind of compare and do best practice. We'll have a quarterly all staff, and then I'll have meetings individually with the different kind of rights at a single facility. Yep, thank you. So the good, better, best approach, this is how we started out doing it, in that you're gonna just take what's missing during your PM cycle, which most of us are doing, right? I can't find XYZ. You're checking, you're giving a note to the department leader, hey, can you help me look for this? That is at least going to keep your baseline inventory somewhat accurate. And then the next approach the better approach was to start to add to do mock surveys. So once a month, once a quarter, you'll land and you'll just start pulling tracers on equipment to see where is the documentation there, is the sticker up to date, all of that from just a physical perspective. And then the best technology would be using scanning software to then validate what your CMMS is saying that you're doing is what is actually relative to the department. So pumps move all over, different items move all over, so you're not going to be 100% consistent. But that would be a very easy way to pinpoint very quickly on if you have that in your CMMS or not, and if it's overdue for a PM. So enhancing through rounding and effectiveness with technology. So AI is a buzzword to everybody. I don't know, sometimes I don't even know what that means. So basically, the tech part of this is getting your technicians to buy in that this is not going to take their job. This is going to make their job easier and more reliable with the data, right? So there's barcode scanners, RFID. We used a software platform called Rapid, where it will bring up the model of it so you can validate right in the field if that is what in fact you're looking at. And then obviously the workflow integrations, finding out is that PM overdue compared to what you say, and then also what is physically on there. And I'll tell you a story, and probably everybody's going to know about it, but there's one vendor that comes out that we pay a contract to that will perform PMs and not update their stickers. And it's pretty much you need to go right behind them and say, could you please come back and update your stickers, right? We have all the documentation. We see where you did what you were supposed to do. And it's kind of, it's not funny, but it's actually kind of a joke at this point that you know that the following day from when they come on site, you're going to be calling them again. So it's important from that perspective too, even if you have a vendor doing that work, is to keep that documented so that when you do your rounding, not only can you locate it, but you can make sure that the PM and the documentation has been updated. So the real world impact of precision rounding is, once again, you're not taking a technician's job, but you're using the efficiencies. And that's really where the buy-in comes in from the technicians. You're using the efficiencies to then let them do their repair work and their maintenance work, as opposed to searching the third floor for multiple pieces of equipment. So, and then obviously for us, speaking of the hospital that was 100% census, they can't afford not to have every single pump available at all times. So that's the enhanced patient care. We're not going, having patients needing to go to a diversion or anything like that. And then the operational cost savings. If you can go right to the equipment, or if you know that it's validated, then you can set it and forget it until the next time it comes around, or for a corrective. And then the call to action is really the backbone of all this data lies in your CMMS. You have to put time into your CMMS in order to keep it consistent, right? So the foundational roundings, that's also involved with your local hospital leadership or your clinic leadership. Once a month, we send a report out to that clinic and we say, you live in this clinic, essentially. Check this inventory that we're sending you and make sure that you can lay eyes on all of it. And if not, then contact us and we need to figure out there. Yes.
Do you ever run into a scenario where you ask people to do that and they are like, you're not my boss? How does that go?
I have not, and if I did, I would definitely go across to my peer and come down, right? But I have not run into that, where they are very grateful to get the inventory, because when the state auditor shows up, they want to have that inventory and they rely on Biomed for that. So it's kind of a win-win, where we're saying, okay, not only are we giving it to you when the state auditor shows up, but we're going to give it to you every month, and you're going to help us keep it in check, right? Yeah. Yeah, I'm maybe unfortunate, but I haven't had any pushback on that whatsoever. Yeah. And then in our CMMS, we make that clinic manager the owner of the equipment, so that if it gets retired or anything like that, they're notified. So, and that's kind of how we have our emails set up. Yeah. Yeah. Investment in tools and training. So I know obviously financial times are hard right now, especially for reimbursement and hospital systems, but it's really important that you pick the right tools at the right time. So for us, our CMMS, we're on year 3 of it now. We were stable in the first year. Now we're doing development with procedural checklists, different things like that. So obviously, in conjunction with that, we have a cyber program, which is very important to know what is vulnerable, where's it at, and that all comes through our CMMS as well. And then I would just say at the very end here, the call to action is to implement a data-driven rounding to enhance the team performance and patient outcomes. That could be as small as you want it to be. You could say, I'm in a round on respiratory, and we're going to do that once a quarter, and then just start baselining that, and then maybe add another department until you get to the more complicated, the OR or what have you, and you really have a good cadence for that. So I would suggest that rather than trying to do some kind of big bang theory where you go and try to do the whole hospital at one time, unless you already do that, which is great. We did not. And then I'll open it up for questions. Any